Hey guys, welcome back to another episode of Nursing Uncharted. It's your host, Anne. Today, I'm really excited about my guest today, not only because who she is, but also what we're going to cover today. I think that this is something that probably every nurse has on their mind, but we don't talk about it. So, before I get too far into that, please welcome Esther. And how about you just give us a little background of your nursing history?
So I've done labor and delivery. It was my passion job out of school. I applied to several hospitals just to get this job. And so far, it's shocked me because it was not what I expected initially. But I've loved it ever since and hoping to grow. I've done other things along the way. I've done some home infusion and I've also dabbled into other specialties, but I've always done labor and delivery. So it's been my thing.
I love that. And we kind of have that connection a little bit because I'm NICU, you're labor and
Yeah, we're
delivery. So
neighbors.
yes, we're always, yeah, we're neighbors. Yes.
Yeah.
Um, so when I start this off with the guests, I always ask, like, what's your passion? What's really heavy on your heart right now? What's something that you just want to talk about and get out there?
Well, my passion in general, I'm always when it comes down to just life in general or working or people I work with or my patients that I work with, always want to be able to reach out and have like a lasting impression on them. That's really what got me into the profession in the first place. I believed that the nurses that I encountered previously to becoming one had that impact on me, and that's what made me a nurse. So I want to pass that on. I want to pass that baton on to people and just be that person that they remember as one that made a difference in their life whenever possible.
And I love that. I know that when we met initially, we always have a conversation before to kind of prep. You had said like those nurses through your experience really just set that path. And I think that I love that that's what you want to pay forward almost,
Absolutely.
to
Yeah.
yeah, to maybe inspire one of your patients to become a nurse like
Exactly.
they did for you.
Exactly.
Yeah. But what comes with doing that, I'm sure, is the almost the weight, like the heaviness of that, and the pressure of that, which, is kind of the direction of this episode, which is highlighting mental health for nurses and, what that looks like. And, I think it's really amazing that you're willing to come on here and kind of share your perspective and what balancing mental health with being a nurse, because we always have to like be there for people, and it's like who's there for us at the end of the day. So, what do you think with mental health? What do you think like are the biggest roadblocks to our own mental health with what nursing is for us?
Well, honestly, the first thing that pops into my mind is what we can't control. Generally speaking, we come in and we want to save the day. We want to have the beautiful experience. As for me, labor and delivery is supposed to be usually the fairy tale experience for patients or their family. And I've been on the other side of it being a terrible experience. And, it wasn't anything that I could have done differently per se a lot of times that made the outcome negative. But, having that responsibility and, like you say, burden to turn it around as much as you can when you can. But, nursing has a lot of highs, especially for our um, specialty, where we can bring children into the world and bring families like this gift of life. And then the other side is things can go wrong, really wrong, and then that's where it becomes really taxing for us.
Yeah, and that's something that I can relate to that where, having a child is the most amazing day in a lot of people's lives, and it can go from amazing to detrimental in matter of
Yeah.
seconds. And, I can't imagine, like, I see my side of things, but being in the delivery room, having that happen, I can't imagine how that affects you. And even, if I hope it's okay for me to say this, but you being a mom, that even that you hold with you and you can almost put yourself in their shoes and just like what does that do to like, what does that do to you? What does that do to our minds, you know?
Right. And, one thing about us nurses, I hear a lot that we are very empathetic by nature for the most part. And, whatever our patients are going through, we feel that burden for them. If they're experiencing difficulty, we feel that burden for them. If they're experiencing, end of life situations, we feel that burden for them, and it goes with us. So, being able to cope with a lot of those things is just part of the mental health blanket. Um,
Yeah.
being there for our patients, and then also being able to have that clear mindset to be able to continue to go forward and give great care. It's a big balance. It's a big balance.
Yeah. And I think one of the hardest things is having to, a lot of times they're not your only patient, right?
Exactly.
So you have to almost switch off and like not be fake, but almost live two different
Right.
lives
Right.
because you can't walk into the next room bearing the burden of what just happened in the other room.
Yeah.
And I'm sure you've experienced that as well.
Yes.
Yeah.
Unfortunately, yes.
Yeah, and I think, you say it's not just the uncontrollable. Like, I really like that explanation. Like, we know as nurses there's gonna be bad days. We know that, we sacrifice our own time with our loved ones to be at work, during times that may be a special day for us, but we have to show up. I think recognizing and talking about this is really something that needs to happen more. And what do we have? What resources do we have right now,
Exactly.
right?
Yeah. So I've heard of, every now and then there's a program like through our health systems and through our employers that we can see counselors. Sometimes those resources are just a handful of visits, every now and then that will be enough for your situation. And sometimes there won't. I've heard of so many nurses that have dealt with like post traumatic stress from dealing with a lot of loss in situations where they just see so many horrible ways that people can suffer. And it just opens up a whole nother avenue of like mental health that a lot of people don't talk about.
Yeah, and I love that you're able to bring these stories of other people's experiences. I mean, that shows that there are people out there
Yes.
willing to
And
talk
we all
about it.
talk to each other. So,
Yeah.
yeah.
Yeah, and I think it's always been one of those, like, taboo things we don't talk about,
Yeah.
right? Like, we're nurses, we help other people, we're fine, right?
Exactly.
Don't take it home with you. Don't take like, that is something that I hear all the time is, as soon as you leave the hospital, don't take it home with you.
Exactly. Leave it behind.
Yeah, like, how do you do
Yeah.
that?
Or leave your home life behind. Like completely cut it off, kind of like the go into the next patient room thing, which is pretty difficult for the human mind. Like we are humans too. And so it's a difficult situation, and it is something that we all deal with. But, we just kind of deal with it.
We do, right? Like, but that's frustrating. That shouldn't be the answer, in my opinion.
Yeah, exactly. Tough it out, tough it out. We can only tough it out, but so much.
Yeah, and you're right, and, like, that's a conversation that happens all the time. It's like, okay, maybe she's having a bad day,
Right.
and then it's like, "Okay, but she's at work, leave it behind." But sometimes you can't.
Yeah.
I mean, there've been times I've gone this year has probably been one of the worst years of my life. Like, I almost lost my brother. I went through a really crazy life change, and how do you just turn that off
Right.
and go to work? Like, I would go to the bathroom and cry and just go back out there and do your job. And, it's sad. And I know I'm not the only one that's doing that.
No,
So,
everybody talks about the bathroom cries. I'm sorry, but it's not a
yeah.
unique
Yeah.
situation. I know I've been there a few times. It's like, yeah, staring at the wall in front of you and sitting on the toilet, or just staring at the mirror for that little bit of quiet time and where you can just be alone with yourself or alone with your thoughts. Something about it is so necessary for us when we're in the middle of what seems to be like a lot of chaos sometimes.
Yeah.
Yeah.
And we always go back to like the pandemic and like what that's added. And it has added extra pressure and stress. But I think that we're coming out of it. I do feel that we're coming out of that.
Yeah.
But we're not emotionally, I don't think that we've fully recovered as healthcare providers.
No. I know I still remember a lot of the things that were really offsetting, I mean, like the unavailability of like proper PPE and
Oh,
um,
yeah.
perception of the public towards us, negative perception that we're spreading COVID. And, I just remember feeling fearful during that time when I was hearing news about people assaulting healthcare workers because they saw them in the open and they were blaming us for spreading
Oh,
COVID. And
yeah.
that was a scary time in, a lot of our lives, most of our lives, probably all of our lives, honestly, in the whole world. But
Hmm.
for healthcare workers, it was a unique experience. It was a very unique
Yeah.
experience. And our mental health, at least mine, definitely, definitely took a toll. It took a hit.
Yeah.
Yeah.
And I all everything that we've talked about, all of these work-life balances, personal struggles, bad day at home, pandemic, fear. When does that overfill?
Right.
And that's when you get into that burnout, right?
Right.
Yeah. And I think unfortunately that's where healthcare is right now. We're in just this like emotional burnout.
Right.
And it's not because we don't like what we're doing. It's just how do we handle doing what we love, but still loving
Right.
ourselves at the end of it, right?
Right. And, you asked me about my passions initially, and, my passion towards others is to care and show that long lasting compassion for them. But my passion towards myself is to have balance.
Yeah.
And a lot of times that burnout is more of a internal, I don't know, it's like an internal trigger of something's wrong, something's not quite right, like an overload of that mental, spiritual, psychological, emotional turmoil inside is just like kind of going off. Something's wrong,
Yeah.
something's wrong, do something about it. And sometimes we can take a break and we can step aside and, go on vacation or something, take time off. But when you come back, it's kind of still, you know, there,
It's still there
ever
because it's not been
really
dealt
go
with.
away unless you figure out
Yeah.
another way to balance.
Yeah.
Um, Sometimes it turns into something different. You might have another experience that adds to the situation, and you can't control that, of course, because life, organic, human
Yeah.
interactions happen, and you never know if it could tip you over the edge or just make it a little bit more alarming inside for you.
Yeah.
Yeah.
Yeah, that just made me think of something, just not knowing, like, when you go back, you have your vacation reset,
Right.
right? We hit the button, but then you walk back into the hospital, you don't know what your patient's going to be. Like, not your patients, but, like, your patients that you're taking care of.
Right.
I mean, that can make or break us, it could just be as simple as, we just don't mesh, and then that just completely undoes all of the hard work
Right. Or it
that we're trying
triggers
to.
you. It triggers that, internal alarm
Yeah.
again, and you're just like, whew.
Yeah. Like, "No, here's another bathroom mirror cry session."
Exactly.
Yeah, yeah.
Exactly.
Do you feel like, I know, like, we've talked before, and, just and I feel this way, is that you have a bad day, and, like, when you're going through that, other than our peers, our colleagues, who else is there for us? What resources in that moment
Right.
do we have?
Right. And sometimes our resources are internal. Um some of us are very resilient to a fault, to the
Yeah.
point where it's just like, we just kind of know how to just, like you said before, deal with it and cover it up and keep it moving. And some of us do have those good self-care practices that keep us mentally stronger or keep us mentally clear or more stable. And some of us have family, loved ones that we can go to. And some of us do have that strong background of mental health practices like therapy and all those things. And some of us just don't.
And don't. I mean, as simple as
Yeah.
that. Some of
Some of
us
us don't.
some of us don't. And I think that's why I'm really excited about this conversation with you and having this episode out there, is those people that don't have that ability, or even just knowing how, therapy is great, right?
Right.
Like, that's the goal of therapy, is to give us coping
Right.
skills, develop coping skills to get through that. But A lot of people don't go to therapy either
No.
because that's also something we don't talk about,
And
right?
we
So
also don't talk about how difficult it is to access therapy because I've always believed in therapy, but there's been extended periods in my life where I either felt like it was just so difficult to get into or, you don't find the provider that meshes with you well. People don't talk about
yeah.
that either. I mean, we say keep trying, but it's like I've been ghosted by providers before. So weird.
Oh, wow.
But, you go through the whole
Yeah.
process and they just don't show up for the visits or whatever. And you're just like,
Oh my
"Okay, I
gosh.
guess I'm just gonna deal with this already," you know?
That's crazy. That's
Yeah.
crazy. That's awful. I mean, and even that process of finding the right fit,
Right.
I know personally I've given up because I'm like, how many times do I have to tell someone, how does that make you feel?
Exactly.
Like, obviously sad.
Yeah,
I'm
exactly.
here because I'm struggling,
Yeah, and it's
like,
difficult for me to just jump on the market and talk to any therapist, so I probably need to get
mhm,
over that. It's probably, like, one of these perfectionist things,
yeah,
but I prefer
yeah,
to get, word of mouth reviews from people that know
yeah,
these providers, and that's my preference, but I think
yeah.
sometimes that holds me back too.
Yeah, well, it does, and it's not fear, but just being
Right,
open and
right,
honest on every level with a stranger
right.
that you've never met before is difficult. It's really difficult, and
It is
everything
interesting.
is telemed now too, which I think that adds a little barrier of difficulty,
Right,
being able you don't have that body language to go off of. You don't have that, like, "Okay, what's the setting, what I'm in?" You're sitting in your house, but what if my house is what's making me sad right now,
exactly.
It's
And
yeah.
it's convenient. It's convenient to have
Yeah, it
that
is.
access that's instantaneous, and you don't have to go anywhere,
Mhm.
um, especially if you're a busy person. But
Yes.
sometimes there's that extra layer of maybe you would be more comfortable in person.
Yeah.
So
Yeah, I do love, like, telemed. That's something we can, I guess, thank the pandemic for that's become a lot more
exactly.
readily available, but, I hope that we get back to a place where there's still the option for the people that need to be in person,
Right.
you can still do.
Yeah.
Yeah. Yeah.
I personally like, face-to-face interactions. I prefer that, but of course, I'll
Yeah.
definitely go for the convenience.
Sometimes we have to.
Exactly.
Yes. Yeah, and, we said earlier about, like, relying on our peers and having those conversations with our fellow nurses,
Right.
but I do think there's been a little shift in how I mean, even how I feel. I think you've talked about how maybe this has, made you feel, but, like, you're almost, like, isolating yourself a little bit
Yes,
more. Yeah.
absolutely.
Yeah.
You can show up to work every day and seem very okay or seem to be dealing with things well and just be really struggling. And I've been
Yeah.
that person. I'm pretty sure. I know for a fact most of us have been that person. And
Yeah.
because socially it's not acceptable to just, of course, vent to everyone about your life or, just spill your guts about everything that's bothering you all the time to other people. So we all carry it a lot of times very like quietly. And sometimes getting used to just carrying it quietly adds to that pressure inside where you're like, I
Mhm.
just got to keep it together. I just have to be okay. And, especially if you have other major roles in your life. Like for me, I'm a mother and also I'm a caregiver for my mother. And so those are all like very strong roles that you have to,
Yeah.
hold it together for. And we're going through stuff. We're going through things.
And it's so easy to just be like, "Yeah, we're just going through it. We're going through
Yeah.
it." But, it's so healthy to have this
Right.
conversation with each other and the vulnerability of this conversation, putting it out there.
Yeah.
I'm hoping that, talking about this more, reaching more people, reaching more nurses will just motivate and, like, hopefully something that we're talking about can just be like, "Okay, like, I'm
Yeah.
okay," And because it can get bad. It can really get bad. It can get bad to the point that you don't wanna be a nurse
Right.
anymore, and you could be the best nurse out there, but you're leaving because you can't
Yeah.
handle it. But it may be because you don't know how to handle it.
Right.
You don't know what to
Or you
do.
feel
And I and
alone.
you and yeah.
Yeah.
Yeah, and I mean, not to get grim, but look at what has happened, the increase in nurses taking their own lives
Yeah.
because of what they're going through. And that I don't want that. No one wants that,
No.
and it's heavy, but it's happening. And we just need to support one another, but also the people that are going through it need to also know that it's okay to talk about
Yeah.
it. It's okay to ask for help.
Yeah.
And, it's okay to feel the feelings because it's real and they're your feelings.
Right. And you're not alone. You're not alone.
Mhm.
If you're going through it, there's a good chance someone next to you is too. And just as afraid as you are of, speaking out or, seeking help, even with like family members or seeking help with trusted loved ones, people that are close to you. And if you really don't feel like you have someone that you can talk to in your home, there are a lot of resources out there, even if it's just one conversation with a person that can lead to someone that you can get help from, like permanently, or,
Mhm.
sort out your personal situation for that time being. But it's
Yeah.
definitely, definitely okay to reach out to someone and get help because
I
it's
love
not worth your
that. I
life.
love that advice.
Yeah, it's not worth your life. And,
It's not.
there are so many people here that love you and want you to be here. And there are so many professions out there that are hard. Even I have a friend that's a resident um, in medicine, and I hear about the same struggles there. And
Yeah.
we're all out here hurting and going through things that we need help from. So needing help is not something that we're alone on at all.
Yeah.
Yeah, we can all use it. So I feel like
Yes.
sometimes at my lowest point, I had this internal alarm going on louder, and I definitely was seeking help, seeking to find someone to talk to. Sometimes I talk to my recruiter. We became buddies.
Yes,
But
you do though. Yeah,
honestly,
I mean, my recruiter got me through a really rough assignment. I called her crying
girl,
every day.
yes, I've had a couple of really good recruiters that I've gotten close to in the past, and there's nothing like having that human react interaction with someone that you feel like you can trust, someone that you feel like has your
Yeah.
back. And I don't know, they probably have some therapy training because I always felt so much better with them after talking to them. Just like, yeah,
Oh.
I
Oh,
never
I
knew my
love that.
recruiter would become like my best friend in certain situations.
Yeah.
It really could be anyone. And even if you're on an assignment, which a lot of us tend to be as travelers, and we're away from home, we're away from familiarity. It's a tough time in and of itself
Mhm.
that people don't talk about. And we're more likely to feel alone, lonely, probably depressed in our down
Yep.
times because we miss our familiar environments, our loved ones. And, you have to call and talk to somebody.
Yeah.
Even if the first person doesn't
Yeah.
answer, seek that interaction because it's important. It's good for you.
Yeah.
And find the things that make
And I
you
love
feel better.
Yeah, and I think that that's a huge piece of advice to take away from this conversation is you have to talk about
Yeah.
it. You have to, even if that's like just simply saying to your recruiter, "You know what? I'm having a hard
I'm
time."
struggling.
Those words, you know, AMN has phenomenal mental health like sources that they can get to
Yes,
you, because I think it's hard, if you're going through something, it's like, that they're out there, right? There's like these like things that you can do that are out here, but how do you get to them?
exactly.
Like, how do I do that? So just simply using a simple statement like that, they the people, any company that you're working for as a travel nurse or even a staff job,
Yeah,
they can get those resources and eliminate that stress of you trying to figure out how to even start this process. They can help that. They can do
absolutely.
that for you and help you with that.
Even talking to like your nurse manager a lot of times, like
Mhm.
I was so shocked because um I've had some drama on assignment. I know if you've been a long time traveler for at least a year or so, you've probably had some drama on assignments. And
Mhm.
just talking to my nurse manager, I learned so much about the resources because, you're having a regular conversation and you just kind of think, okay, I'm going through this. And then they're like spewing out all these resources that you're having. You're just like, oh, that's available to me. I didn't know. But if had you like kind of like kept it to yourself or, not opened up about it to anybody, you wouldn't know.
Yeah.
So, your nurse manager, your
Yeah.
recruiter, anyone that you feel like you can have a personal conversation with safely, you know, talk to them. You never know who
Yeah.
can help.
That's right. That's right. I feel like we just kind of like summed up this episode organically. Like I was like, okay, how are we going to close this out together?
Yeah.
But I really think that that's something to just take away from this is it's
Yeah.
okay to feel what we're
Yeah.
feeling. You're not
Yeah.
alone in your feelings, even though it can feel extremely isolating and extremely alone. But just ask one person to help you, and it can save your life,
Right.
or just make your life that much easier.
Right.
And,
And don't throw your career
it's,
away just because of
yeah,
all the stress. I've
yeah,
early on in my career, I met nurses that been through a lot of trauma, like trauma nursing, and had PTSD and chose to just step aside and do education, do something else that's a little bit more friendly, at least for a
hmm
time being where you can just like get better. Like take away the
yeah,
trigger long enough for you to help yourself first. And then if
yeah.
if it's a passion job, if you feel like it's feasible, you can return. But don't run away from nursing completely because of it. Because that I know we're all tempted. We're just like, I'm done.
Yeah,
Yeah.
yeah. And correct me if I'm wrong, but are you thinking about even advancing
Absolutely.
your degree?
Absolutely.
Yeah,
And
yeah. So that's a way to
yeah,
just pivot a little bit that can help
it's
you.
definitely another transition. I've always known I wanted to do advanced practice. And so it's always just been the timing for me. And
Yeah,
I always wanted to get my son through college first. But he's not on my time. He's got his own timeline. I got this
yeah.
timeline. He's like, whatever, Mom, I'm doing my own thing. So I'll probably just go ahead and go back to school for me on
Good,
my time.
good. You should.
Exactly.
Yeah,
But
yeah,
yeah, we just have to make those decisions for ourselves whenever
yeah.
possible.
Well, that's really
Yeah.
exciting. I'm excited for you,
I'm
and
excited
I'm
too.
really grateful for you, Esther, coming on here and just opening up and being vulnerable and having this conversation. I think this is gonna set the platform to have more of these conversations, possibly have this conversation with you again in future episodes,
Absolutely.
and just make this the norm to, just acknowledge what we're going through.
Right. Ironically, I'm
Yeah.
trying to dabble into some mental health nursing. So
Look at you. See? Look at this.
yeah,
So then when that happens, you can come back and give the listeners some tips on how to manage those tough
absolutely.
days.
100%.
Aw. Well, is there anything else you want to get out there? I mean, I think that what you've said so far is just so supportive and powerful, and I'm I'm excited for this to reach so many people.
Yeah, I hope, honestly, like I said, my passion is to reach out and be able to make that difference in whether it's patients or people that I meet randomly. And unfortunately, we don't always have that control. But whenever we do have the
Yeah.
control, I try to go out and do it. So this was a
Yeah.
great opportunity for me. Thanks for having me, Anne.
Good.
Um,
Of course.
and
Of course.
yeah, I'm excited to come back in the future.
Yes.
If it happens, that would be great. And
Yes.
yeah, I hope everyone that hears and that needed it gets the help they need, or at least know and understand that you're not alone. That's a good
Yeah.
feeling in and of itself. But
Yeah.
going forward, being able to put those things into practice, like reaching out to somebody, is a big deal. Hope anyone
Yes,
can
it
take away
is.
from it.
Well, thank you so much, and I'm sure we'll be seeing more of you
Oh,
in
oh
the future.
yes. That would be great. I would love that.
All right. Take care. Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.